Hey folks, Nick the nurse here. Today we're going to be talking about blood transfusions as they might come up on nursing school exams or perhaps even on your NCLEX. Blood transfusions are a constant source of worry for nurses because they have the potential to go wrong. They have the potential to be unsafe if certain protocols, policies, and checklists aren't followed before giving blood. So one of the big things that you have to remember with a blood products transfusion is that you need to have two licensed nurses checking the blood. They need to be doing a check. They need to be verifying certain information that's correct between the physician's order and the piece of paper with the order and the actual unit of blood itself. So some of the things that they need to verify include the patient's name, the patient's date of birth, their medical record number. They also are going to need to check the unit number from the unit of blood to make sure that it's a correct unit. They need to actually check that the blood type is the same on the requisition as it is on the unit of blood itself, because there have been situations in hospitals. I heard several years ago that a patient got the wrong unit of blood on television, and you don't want that happening to your patient both on your nursing school exam or in real life. So we want to make sure that we double check and verify all of these things. Another thing that we also want to make sure that we verify when checking blood is we want to make sure that we know the expiration date and time, because blood does not have an infinite shelf life. It has a definitive shelf life, usually about 4.5 hours. So we want to make sure that we don't keep the blood hanging longer than that. Look to your particular facilities policy or protocols, but usually it's about 4 to 4.5 hours. And if the blood isn't transfused within that period of time, it needs to be taken back to the blood bank. So make sure that you remember that as well. So lots of different things to remember. Make sure that you as a nurse have a second nurse verify all of these things verbally with each other before giving the blood. Very good for safety reasons, very good to prevent you from having any litigation, and most importantly, it keeps your patient safe, and it's good to know on your nursing school exam. So again, remember and be familiar with those concepts. Again, my name is Nick the Nurse. I'd like to thank you for watching my video today. If you'd like to check out any of my other completely free videos, they're all online at www.nickthenurse.com. No spaces between Nick the Nurse. Again, that's www.nickthenurse.com, or feel free to subscribe to my free YouTube channel, Nick the Nurse. Thanks for watching. I'll see you next time.